A video summary of the original blog found here, https://bmidoctors.com/semaglutide and IBS in-depth analysis and insights. Imagine living with constant abdominal pain, unpredictable bowel habits, and the anxiety of never knowing when your symptoms will strike. This is the reality for millions suffering from irritable bowel syndrome, or IBS. IBS is a complex gastrointestinal disorder that affects up to 15% of the global population, significantly impacting their quality of life. Symptoms of IBS include abdominal pain, bloating, and changes in bowel habits, ranging from diarrhea to constipation, or even alternating between the two. The quest for effective IBS treatments has led researchers to explore various options, from dietary changes to medications. One promising development in this field is semaglutide, a medication initially approved for type 2 diabetes and obesity. Semaglutide belongs to a class of drugs known as GLP-1 receptor agonists, which mimic the action of a naturally occurring hormone to regulate insulin and appetite. Given its effects on metabolism and gastrointestinal motility, researchers are now investigating semaglutide's potential in treating IBS. But what makes semaglutide so intriguing for IBS treatment? It's all about its impact on gut function and motility. Semaglutide slows gastric emptying and modulates appetite, which could help normalize bowel habits and reduce abdominal pain in IBS patients. Early clinical trials and anecdotal reports suggest that semaglutide may offer symptom relief for some IBS sufferers. However, the exploration of semaglutide for IBS is still in its early stages, with much of the evidence coming from ongoing research. To understand the potential of semaglutide for IBS, we first need to delve into the current landscape of IBS treatments. Dietary modifications, such as the low FODMAP diet, are often the first line of treatment for IBS. Lifestyle changes, including increased physical activity and stress reduction techniques, also play a significant role in managing IBS symptoms. Pharmacological treatments vary based on the predominant symptoms, with options like laxatives for IBS-C and antidiarrheals for IBS-D. Psychological therapies, such as cognitive behavioral therapy and hypnotherapy, have shown promise in reducing IBS symptoms. Despite these options, many patients continue to struggle with managing their symptoms, highlighting the need for new treatments like semaglutide. Semaglutide's mechanism of action involves stimulating insulin release and slowing gastric emptying, which can reduce appetite and caloric intake. These effects are beneficial for weight management and glycemic control, but they also have potential implications for IBS treatment. The theoretical basis for using semaglutide in IBS includes its ability to modulate gut motility and reduce visceral sensitivity. Preliminary studies have shown improvements in gastrointestinal symptoms, such as reduced bloating and more regular bowel habits, in patients treated with semaglutide. However, comprehensive clinical trials focusing specifically on IBS populations are needed to fully understand its efficacy and safety. The potential benefits of semaglutide for IBS patients include simplified treatment regimens and improved quality of life. But there are also challenges, such as the variability in IBS symptoms and the potential for gastrointestinal side effects. Healthcare providers must carefully consider patient selection and monitoring when using semaglutide for IBS. Patient case studies provide valuable insights into the real-world impact of semaglutide on IBS symptoms. For example, a 42-year-old female with IBS-C reported significant symptom relief and weight loss after starting semaglutide. Another case involved a 35-year-old male with IBS-D who experienced reduced diarrhea episodes and improved quality of life. Expert opinions highlight the need for further research to establish clear guidelines for semaglutide's use in IBS treatment. Future studies should focus on long-term effects, patient-reported outcomes, and the impact on the gut microbiome. As research progresses, semaglutide could become a key player in the IBS treatment landscape, offering new hope to patients. Stay tuned for more updates on this promising treatment. Semaglutide, a potential game changer in the fight against IBS.